It's absolutely impossible to view the carnage on the ground everywhere, whether it's poverty or maternal mortality or infant mortality or AIDS, tuberculosis, and malaria, or putting kids into school, or gender equality. All of these issues require collaborative global responses, and thus far we're not getting it. We're at a kind of crossroads internationally around global health. It's why the big government, the UN agencies, and the major NGOs and the indigenous talents in the countries themselves, why they have to work together to put a halt to what some people would call genocide. But by God, when you've got millions of people dying unnecessarily and you can do something about it, and you fail to perform and fulfill your mandate, something's wrong somewhere, and someone has to be accountable.
It's the day before the symposium that we've been planning, thinking about, and dreaming about for 2 years. I'm excited because of the people we have coming. It's really an incredible bunch of people who are coming. We have leaders in global health from all of these different problem areas, so we're bringing them together. There's also going to be, I think, a little bit of suspicion. Everyone's going to eye each other, and they're going to say, is it okay for me to get up in front of this audience of really distinguished people and speak openly and speak honestly? I hope that they feel that they can, and we're going to do everything to make them feel that they can.
What you have at this meeting are people who lead, and many good leaders are people who will look very objectively at the facts, and if things aren't working, they're going to say it. They will say challenging things.
And I think out of this symposium of top experts in this field, there are certainly going to evolve some very specific things that we can do together. And we've learned quite often that, that collaboration and cooperation and partnership could be extremely effective, and we've also been able to ascertain those areas in which we are not yet there, that we have not yet formed a proper coordination.
This commitment to improve health partnerships is at the heart of the work organized by the Task Force for Child Survival and Development. Many of the symposium's participants have played important roles in some truly extraordinary global health successes, such as smallpox eradication, polio eradication, and controlling childhood infectious diseases.
This is not a subject that people usually talk about. We've put a lot of thought into the agenda. We've really thought through the panels. We've tried to stimulate thinking. We want to know how you tried to build a coalition, who you needed to work with you, how you got them to work with you, what were some of the barriers you faced, and what was the success.
There are many problems, though, where collaboration hasn't worked so well. And this symposium was designed to look at the urgent global health problems of today, where new collaborative approaches can make a crucial difference. Sometimes the sheer number and diversity of the agencies involved itself creates a problem.
You see divided interests by individual agencies, each one of them having its own agenda, each one having its own goal. Sometimes when they should be collaborating, they are competing.
It's important trying to look at the faces of those voiceless who are waiting for our synergy to make a difference in their life. Unfortunately, we are still continuing to talk about our mandate, talk about our specific organization, and we don't have enough time to look in the eyes of those deprived people who don't know UNAIDS, who don't know WHO, who don't know UNICEF, but they know that they are suffering and they need this support, and they need this support in coordinated manner.
The world has changed dramatically since WHO was established, and at the time it was established, it was clear that the countries were giving it the authority to direct work in international health. But that was based on an understanding of health that was quite hierarchical. You needed one organisation in charge. The architecture is no longer like that. It's much more like a network, much more like the internet. There's a whole range of different organisations out there, much more complex, much more diverse. And a hierarchical approach doesn't work. And if, in fact, you try to implement a hierarchical approach into this sort of network, it's very toxic. It's not just that things go wrong in terms of WHO's work, it means that people suffer because effective collaboration that could have made a real difference isn't happening.
They are more willing to invest in short-term.
I think the presentations were striking, and the other thing that was so gratifying is that people dug in and got involved. There were students sitting at the same tables with people who'd worked in the field for 30 or 40 years, and the interchange was very rich. The people who were talking about their successes were able to transmit the keys of what made it work to the people starting to take on the new problems. And there was such enthusiasm for both camps. The people who pass on the wisdom were excited, and the people who received it were ready to go out right now and apply it. It was wonderful to see.
For me personally, as sort of a younger member of the global public health community, it was really wonderful to learn about the extent of collaborations in the past and how new collaborations will be needed and how those new coalitions will be different than the ones in the past. And often when I hear people share their experiences, I'm thinking of global health leaders who are of my generation and how are they going to learn from this and build coalitions, and through those coalitions, effective collaborations.
While one might say that collaborators are born, not made, I would have to actually say that collaboration is a skill that is developed. It is eminently teachable. It is not to say that it's easy. I mean, there are lots of barriers that still remain. There are the different cultures of organizations in different sectors. You have organizations that see each other as competitors competing for funds, and they don't want to collaborate. They want to take credit themselves. You have the fear of losing control when you collaborate, putting your fate in the hands of someone else.
The most significant factor in success of any of these partnerships is the quality of the people. Because the structure is imperfect, the tensions are great, the concerns about loss of power. So these are people who can control their egos. They don't have to dominate. And I think that's one of the great lessons of watching a man like Bill Foege.
I think there are 3 practical steps in making this work. Number 1, if you don't have a clear goal, and I say collaboration starts by being able to define the last mile so that everyone has a feeling where they're going. Number 2, a very clear strategy for getting there. If you can't outline the strategy, it's not likely you're actually going to get there. And number 3, I think the grantee should come up with how are we willing to be evaluated? What are the points that we're willing to say if we don't achieve this, we failed? And how will that evaluation be done? I don't think the foundation should come later and say this is how we're going to evaluate you. But if you have a clear outcome, a clear strategy, and everyone knows how this will be judged or evaluated, I think those are the essential parts.
I think in terms of the plenary presentations, President Carter kicked it off and made it very clear that collaboration is a central part of what he's committed his life to.
The most serious need is a lack of a generic coordination or cooperation among the people who are assembled here and the ones that you represent. And that would include the World Bank and WHO and UNICEF, USAID, the Centers for Disease Control, the Gates Foundation, the Rockefeller Foundation, the pharmaceutical companies, and NGOs little tiny ones like the Carter Center. But you see that the coalition here is so broad-reaching and all-encompassing, but where is the coordination? Where is the cooperation? I think that kind of dividing up the responsibility and benefiting from the experiences that each one of us has could be wonderful.
But he sparked people's interest and enthusiasm, and that was a wonderful kickoff and a way to focus on the importance of the issue. I think there were people on panels. Michael Sidebe from UNAIDS spoke about the terrible morass that falls on a country like Tanzania, showing how many different agencies want how many different things and have how many different requirements and insist on how many different meetings. Just visualizing that, he had one slide that if you look at that, it will absolutely drive you crazy. And he offered the promise of how we might improve that by working closely with the country itself and letting the country organize the issue. So I think that picture stayed in everyone's mind throughout the duration and gave us a goal we're aiming for, how we're aiming to improve it.
It's pathetic to say that after 20 years, we are still having 5 million new cases every year. Which means what? It means that we fail probably to make drugs available to those people, to prolong their life. We fail certainly to bring necessary information which is needed to prevent those millions of people to be infected. Most of them are young people. So I found this meeting critical because it was the first time people were not just talking about how to build infrastructure, how to bring commodities, but it is the time people were trying to reflect on how to do business differently, how to collaborate, how to create synergy.
I lose patience profoundly with the statistical documentation because it always leads to abstractions. Everything is in the millions, whether it's people or dollars. But what you're really doing is fighting to save individual lives. You're fighting to overcome the individual human predicament. You know, when I'm in Mozambique, as I was just a few weeks ago, and I visit the Beira General Hospital, and I walk into the women's ward, and there are 54 beds, but there are 80 to 90 women in the ward, all of them young, all of them in their late teens, 20s and 30s, all of them, almost all of them with AIDS-related illnesses, and most of them co-infected by tuberculosis. And they're lying on the concrete floor of the corridor. And they're lying on the floor between the beds. And they're lying on the floor under the bed. And they're lying two to a bed. And the families are in the room. And there is a kind of Kafkaesque contagion of death and despair, which is unbelievable. And you stand at the door of the ward and you think to yourself, the world has gone mad. How is this possible? How is it possible that in the year 2006 we can be losing so many young women unnecessarily? We have the drugs to keep them alive. How is this possible? And you know that it's happening because of the failure. The failure of the world at the level of the country to join together to respond to the pandemic, to defeat it, to collaborate with each other in the service of keeping these women alive so the orphans aren't left behind, so that young women have a life to lead. It's not snuffed out in agony.
My interest in collaboration extends back over my career, but perhaps the two most important pieces relate to the creation of IAVI, as we call the International AIDS Vaccine Initiative, which is about trying to drive the development of a vaccine against HIV. At every step of the way, we had to form partnerships and relationships, not only with governments, with local advocacy groups to make sure that trials would occur, but also with pharmaceutical companies, biotech companies to get the best products moving forward, with the other agencies working on research. And, you know, it's been quite complex to do that. One other thing to mention is that this unique way we work is is by doing and focusing on the needs of the developing world. So we do our trials in the developing world. We do them, all the vaccines we make are made from strains of the virus that are circulating in those parts of the world. And again, this was a huge sea change, because it began to show that if you worked with local communities, if you worked with local scientists, you could get extraordinary results. You could do trials incredibly fast. You could get quality that was even better than in the developed world. And it also gets the buy-in that makes people feel they're part of the solutions and not just suffering the problems.
Or not everyone has worked on developing a vaccine against the AIDS virus, but everyone has been in this position of trying to collaborate, of needing to collaborate. I think it also provided an exchange between North and South that in a lot of meetings doesn't happen.
I think we have a very serious imbalance of power and listening between the North and the South in the attempt to form collaborations to help in global health. But in the end, we are guests. We're there in their houses. And I think you've got to start with the question, what do you want? What do you need? The goals must be the goals of the nations in the South that we're trying to help.
The process of arriving at priorities and so on quite often excludes or ignores or downplays the role of the recipient countries. What we've seen in international health is that over the past 50 years or so, every 10 years, the priorities of the donors change. There was a time when it was nutrition, and if you did not have nutrition in your program, forget it. Then it was family planning, and then there was a time when it was primary health care, and so on. Meanwhile, countries are trying to shape and adapt their programs to be able to reflect the aims and wishes of donors rather than systematically building up their own capacity and their own interests.
I often think that the people who are closest to our beneficiaries, if you will, are oftentimes the ones who are best at collaboration, because they're closer to remembering who are we doing this for. And it's often the headquarters and those who are more distant from it that breed the greatest sense of competition, because at the headquarters, people are more concerned with the preservation of the organization. And I think it's the people who are at the grassroots who often need to keep reminding us that it's really not the preservation of the organization, it's the preservation of life. It's the improving of the quality of life at the grassroots level. I also think that sometimes we forget that the process of collaborating and partnership is also role modeling, because as we're working more with civil societies and trying to build a way of doing business, the societies that we're working in have a lot to benefit from seeing us collaborate better and seeing us be better actors in that regard as well. And so I think while we want outcome, sometimes the process itself is incredibly important as well.
We talked about the role of donors, and unfortunately most donors, whether it's a philanthropy or whether it's a bilateral aid organization, don't have the time or the ability to help the recipients of their aid collaborate effectively.
I think if we're going to do public health, we have to be willing to admit when we're not succeeding. If people believe that blind adherence is all that the funders are about, then they give up hope that there actually will be solutions to their problems. And the destruction of hope, I think, is probably the most grievous sin of this kind of blind adherence to what you believe the funders want. In the domestic U.S. public health scene, it's less stark. You look at Hurricane Katrina and the mess that resulted after that. It is a great example of where people said, yes, sir, we are doing as requested, and we are full speed ahead, and we are fully prepared. When in fact, everybody knew that if something significant happened, it would fall apart. The Gates Foundation may well turn out to be the tipping point for global health. I think 100 years from now, historians will look back and say, two people changed the whole trajectory, Bill and Melinda Gates. With resources, it is easier to get collaborations, easier to get coalitions. Now, I happen to think that the real value of a foundation is right at the beginning. Once you've given your money, people pretty much will try to change the rules. But beforehand, you can insist on certain objectives. One examples that I like to recount from the Gates Foundation is in guinea worm eradication. The foundation received requests from 4 different organizations, and those 4 organizations had had some difficulty working with each other in the past, and now this was just one more step in the competition of trying to get resources. And so I was able to sit down with representatives of the 4 and say, the Gates Foundation is going to make a grant, but only one. If the 4 of you can figure out how you will structure that, then there will be a grant. If you can't, there won't be a grant. These 4 people, within 2 hours, had figured out how to do that. You can only do that before you give the money, not after you give the money, and it's worked so well.
Well, one of the questions, and if you look at the world, is the architecture of the multilateral, the UN agencies, the Bretton Woods institutions was set in stone now, more than 50 years ago. And the world has changed dramatically, and those institutions haven't. And so one of the challenges now is how do we create new compacts? If we're going to make a difference in the world now, it's not going to be the private sector alone, because they don't have the motivation to necessarily do this. It certainly isn't going to be the UN alone or individual governments alone. It's going to have to be some combination. So how do you best use the tools of the private sector with the mission focus of the public sector, bring them together in a way that can be really effective?
So if you think about businesses, perhaps a traditional way to think about them is, write us a big check, please, and then go away. That's leaving a lot of value on the table. Now, it's important philanthropically to have companies donate money, donate drugs. In fact, I think what is emerging is that the other competencies that business can bring to the solution here, in collaboration with our nonprofits, with our government agencies, international organizations, are there sets of managerial skills, the infrastructure that they have built into their normal way of doing business. Those are distribution systems that can distribute more than simply their product. Their capacity to organize, that's what business people do. They organize and mobilize resources. Their convening power, they are able to bring to the table many partners that otherwise might not be at that table. So I think that we are seeing new actors come in and interacting with traditional organizations in very different ways, and this is really important.
One of the most interesting collaborations is the collaboration to give Mectizan to prevent blindness in people who live next to fast streams in Africa and who get blindness from a parasite called Onchocerca. This all developed because Merck in the early 1980s put out a drug for heartworm in dogs. But then a scientist from the subcontinent, Muhammad Aziz, got the idea this might be useful in a human disease, onchocerciasis, and it turned out to be a wonder drug. So Merck now had a product that would prevent blindness if given once a year to the poorest people in the world. So they came to Atlanta and they asked if we would figure out a way to distribute this drug if they gave it free.
The donation from Merck & Company to provide Mectizan for all who need it, for as long as needed, was really the beginning of this amazing partnership. Because one of the dangers with public health, there's a tendency to think all you need is the drug, but actually implementation costs quite a lot of money. Health education, training, logistics, fuel, getting all the way into the rural areas.
Well, this is such a great example of collaboration, because it now rests on some 27 or 28 ministries of health around the world, helped by the World Health Organization, UNICEF, the World Bank, United Nations Development Program. It has been worked on by all kinds of voluntary agencies, mission groups, foundations, by village committees who actually do the distribution in many places, with the drug being given free by Merck. It's a Polybius story of everything affecting everything. And I say even the dogs of America become involved because it's the sale of the drug to dog owners that has provided for the profit that allows Merck to give this away free.
Much was achieved during the symposium. President Carter charged the group to come up with concrete proposals, and he pledged his support to lead this effort. Participants called for concrete outcomes, including assessing donor performance, leadership training in collaboration, and a Center for Global Health Collaboration to take on these tasks and act as a neutral convener for partnerships, to be initially housed at the Task Force for Child Survival and Development.
I think it turned out to be a very good meeting. We started out looking at some of the things that have gone wrong with coalitions. Today we looked at successful coalitions and why do some things go right. And then in the last hour and a half, everything coalesced where the participants want us to come together with some of the rules for a toolkit and then figure out how can we get accountability in the entire system in order to make it better.
I think for all of us, we see that this work is just beginning. There's so much that could be achieved. And it's not that we build a better way to collaborate. It's that we will save lives from AIDS. We will prevent kids from being orphaned. This will empower the work that we do. This work is just beginning, and we can make such a big difference if we can do it together.